Hi, my name is Dr. Connie. So I felt really compelled to come in front of you today and talk a little bit about what troubled me this week. So yesterday, I have a very dear friend who is a pelvic surgeon. She does a lot of fertility treatments and she does a lot of pelvic surgeries for those of us who have endometriosis or any type of adhesions, or if you were born without the proper plumbing, such as vaginas and such, then she'll put in, and she is the most amazing woman that I know. So she sent me a patient, and this particular patient, it really affected me yesterday because she was 26 years old and she's a nurse. She came in with severe pelvic pain yesterday. It's called endometriosis. What that is that you have adhesions or scar tissue growing outside of your uterus, like into your abdominals and such. So the real question you should be asking is what's causing that inflammation, right? Anytime your body reacts and there's an overgrowth of some scar tissue, which is what that is, that means there is a fuel to the fire, so to speak. And so something is kind of propagating that reaction in your body. And so what happened to her was at 13, she started to have severe pelvic pain, and she went in for exploratory laparoscopy, which is just cutting out the scar tissue. And then she had another one at 15, and then another one at 17. And at 19, she had to have another one. And every time she went in, and every time the doctor went back in, the scar tissue was more and more abundant. And so it just killed me because in 2014, she kind of told me that they went in and then they had to take out the ovaries at 19. And so they took out the ovaries, but prior to doing that, she, of course, had to get her eggs and freeze them for future use in the hopes of carrying her own child, leaving the uterus intact. Well, in 2015, due to significant pelvic pain, she had to go back under the knife. And then there were two surgeons, and then she ultimately had to take out her uterus along with the ovaries as well. And so now she comes in post all that. They're talking about another exploratory laparoscopy, knowing that after such multiple surgeries, that this person is predisposed to getting more and more adhesions, which are scarring of your tissue, right? It's an overreaction. And so I treated her for the first time. She has a very difficult time having any type of intercourse. She has a steady boyfriend who she hopes to marry. She's been with this guy for over 6 years, but she says she can't have it comfortable, intercourse, as well as not be able to go defecate, which means have a bowel movement without significant pain. And now she can't even urinate without having significant burning. So what that's going to become is now interstitial cystitis. It can get into your bowel overgrowth, so it can be obstructive bowel issue, and a lot of these patients will go on to have lots of autoimmune conditions. So let me give you the statistics on this, because you guys are lupus patients. 1 out of 3, okay, so 33% of us have multiple autoimmune conditions, whether it be celiac with lupus, fibromyalgia with lupus, or scleroderma with lupus, or rheumatoid arthritis coupled with something else. And I've learned that many of us have multiple autoimmune conditions stacked on top. So at some point you have to wonder what is causing all this dysfunction is what this is, right? Disease is nothing more than your body being out of balance. So I really want to challenge you to, when you do go seek a doctor for care, always ask informed questions and make informed decisions before you have anything removed. Because the reality is, we have body parts that exist in us for a reason. They're not meant to be taken out. As you can see, a 13-year-old who lived with pain for 13 years, half of her life in pain, now doesn't have any body parts or female body parts to speak of. and she still ultimately has pain. So I really thought about the future outlook of these patients, and she's an isolated one that hit me hard yesterday, but I've had multitude of teenagers coming to me in the last year alone. I've had, over 10 that had pelvic issues of some sort. And so we're getting some type of disruptive endocrinological, immunological, systemic dysfunctions occurring today. So pay attention, because I know many of you have kids. I have kids. If you have daughters, pay particular attention to some symptomologists, because we're exposed to a lot of toxins. And a lot of the toxins are good, and working on the food is a good thing. But also, always remember our brain health and our motivation to do things, and all these things have a place. So kind of take a collective look at your life and work on reducing your stress, living mindfully and being present with signs and symptoms that your body starts to tell you. Because I can tell you, most of us are walking daily lives and, just living day to day in a sort of a trance of constantly checking our messages on our smartphones or social media posts, or constantly we're wired to something, and that sort of displaces us from our body. And so we no longer pay attention to our symptoms. We don't pay attention to our body, so we can't really acknowledge what's happening, right? But if we're tuned into our body, we'll start paying attention to our posture, in the way we breathe, the way we feel. We'll sort of kind of understand like some physiological difference between not being well when you're so tuned in. But those symptomologists should not be, dependent on other providers to tell us exactly what to do. So this whole idea of taking charge of your health, it really starts with learning a lot about it, reading a lot about it, and understanding there's a little bit of intricacies in everybody. And while lupus is the umbrella term for most of us, everybody, like every single lupus patient has different symptoms, right? And so it's highly individualistic. And so start owning your body. By that I mean, be mindful of the way you stand, be mindful of the way you breathe, be mindful of the way foods make you feel, be mindful of the people around you. And if it's something that kind of stirs a little uneasiness in you, trust your gut instinct, because we've done away with that. Now we've just become so transfixed on our media, like I said, to tell us what to do. It's sort of like most of us don't even know who we are anymore, because society expects us to be something. And I think a lot of, within the lupus group alone, I've learned the expectations that other people have, expectations in us not doing what other people expect of us, and the guilt that we live with. It is a crazy cycle if you really think about it. So start being mindful. Starts with you. Whenever you have these anxieties or pain set in, take a deep breath and breathe. And anytime you want to ask me some questions about something, please send them my way. While I know not everything, but I can certainly direct you to the right place so that you can get and make informed decisions about your health. So I hope that this helps. I'm going to continue to post and interact with you in as many outlets as I can. So I'll talk to you next time.